Hello, I'm Sanjeet Graywal. I'm a neurosurgeon at Mayo Clinic, Florida. I'm interested in epilepsy as well as movement disorders and complex pain. Today, I'm going to be talking about epilepsy with one of my partners here.
Hi, my name is Dr. Joe Servin. I'm an adult neurologist that manages adult patients with epilepsy, and my clinical interests are within the area of epilepsy, primarily acute seizure emergencies. Epilepsy hasn't responded to medication, surgical management, and also quality of life issues as it pertains to seizures. And I work with Dr. Graywal here at Mayo Clinic in Florida.
And we'd like to let everyone know that we are not wearing masks right now. However, we are social distancing in each other's respective offices. Dr. Servin, I think it's important when we begin this conversation to let people know exactly what is epilepsy. Is it a disease or a disorder? How do we define it?
Yeah, that's a great question. It seems so simple, but it's looked at in different ways in terms of how we think about it. In terms of either it's a condition or disease. I think of it as a disease. It's a situation in which someone has repetitive, unprovoked seizures. So it's typically more than one seizure, and it's unpredictable. And it often comes with a lot of other things than seizures. It comes with memory complaints. Typically, people talk about they can't remember things that just happened. It also comes with a lot of psychiatric comorbidities. That's a fancy way of saying depression and anxiety. And all three of them together, the depression, anxiety, seizures, the unpredictability, the problems with memory, they all kind of go hand in hand. And I'm sure you see that yourself in terms of just when you see these folks, that it's not always just about the seizures.
Yeah, I think, often we tend to focus on just the seizures, but it's the quality of life is affected by all three of those things that our patients have to deal with, unfortunately. And the hope is that if we can stop their seizures, we can improve the other two aspects of this disease. Um, you know, you mentioned that they have to be unprovoked seizures. Can you tell me a little bit more about what you mean by that?
Yeah, at the end of the day, if I know if I do something, let's say take a certain medication or have some circumstance, maybe I had too much to drink, for instance, and I have a seizure as a result, well, that's considered provoked because I had too much to drink. I didn't sleep enough. Those things, you can do something about them by getting the sleep or stopping the alcohol. So those are considered provoked. You can do something about it. When it's unprovoked, I have slept. I haven't had any alcohol. I haven't done anything wrong, and yet here I am still having seizures. That's when we're talking in the world of epilepsy specifically, because that means I need help. I need something other than changing my behavior to help me to stop this. And that's where it really starts getting into the world of treatments that are available for folks.
Yeah, I agree. And it's interesting because often people tell me, I think I've had a seizure, but I don't really know what a seizure looks like. And I think a lot of the time I spend talking to patients is about describing how seizures can present in so many different ways, right? Some people have these staring spells. Some people have jerking motions of their arms or their legs. I think it's really important for us to describe, some people's seizures only come in sleep and they wake them up out of sleep. Some people don't even notice that they had a seizure. We recently had a family that told me that, their family member would have 5 seizures every night. They would come in the morning and would have no idea that they've been, having seizures all night.
It's so huge because the truth is that seizures can present in so many different ways, and a lot of times It's this fact that everyone has their own mental picture of what it looks like. Because most people think of it like when you're watching some sort of TV show or movie, that it's a very dramatic event. Well, it can be dramatic, but it can also be very quiet and confusing. And people don't always, the person who has it, don't always remember it. And that unpredictability and the fact that you're always stuck having to explain what they look like to others. If if you're explaining it to the patient's probably explaining it to a family member, a friend, and people just don't know how to kind of compute it all, and that's what makes it so hard.
Yeah. And once someone's been diagnosed with epilepsy, then what can we do to help them with it?
Well, here's where I think we're in a really good place. We have so many treatments. There are now literally 28 with a couple more coming up. So we'll be close to 30 different seizure medications approved for the treatment of seizures and epilepsy. There are devices, which I know you're very experienced with. There is surgery that you're very experienced with. There's even the ketogenic diet that is available. For certain unusual types of epilepsies called autoimmune epilepsy, which is because of a funny antibody, there's now treatment that is about like controlling your immune system to get us to epilepsy. I think that the big point I would kind of make in this is we have so many options that there's tons of hope. And it isn't just that it's those options. There continues to be research and more work to develop even better options to try to help people give them back the quality of life.
Absolutely. I think one of the key words you put in there was hope. Often our patients have been dealing with seizures for 15, 20 years, have tried multiple medications, and they get to a state where that hope diminishes. They feel like they're going to continue to have seizures. And I think one of the benefits of a multidisciplinary team like ours, where you have multiple doctors from a neurology standpoint who are working on epilepsy, multiple surgeons, neuropsychologists, neuroradiologists, all looking at your case, is that, you know, there are other things that we can do. Like you said, there's all these new medications that can potentially be helpful. And for patients who fail medications, which means that, they've tried at least two medications and continue to have seizures, surgery can often be a very helpful way to help stop their seizures. And if we can't stop it, we can at least help reduce the frequency and the severity of these seizures. Um, One of the wonderful things that I found about working with you and some of my colleagues at Mayo is just the collaborative nature of taking care of a patient. It's often just a phone call to say, hey, Sanjeet, there's a patient I think that we can help. Or, once a month we do a conference between not just our neurologists and neurosurgeons at Mayo Clinic Florida, but between the entire enterprise at Mayo Clinic Arizona and Mayo Clinic Rochester. So as a patient, you get, I would say, 40 or 50 neurologists and
That's true.
neurosurgeons looking at your case. So just know there's always hope.
Yeah, I can't, you said it beautifully. I don't have anything to add other than we all work as a team. There's I always kind of tell folks that there's a system of second opinions already built into when you see us because of all the extra folks that can be there. I think that having that team is essential because of all of the ways that seizures present and affect people. And it isn't just a neurologist or neurosurgeon, but there's neuroradiologists that are amazing, and neuropsychologists. There are the nurses, there's nurse practitioners, there's PAs, there is the electroencephalography or EEG technologists. these are all members of the team that they're all there to help you. And to me, one of the exciting things is that we can't, there are for some people cures, and you mentioned epilepsy surgery. I mean, that is for certain candidates, that is a cure. It stops this, it makes it go away. And if you're a candidate for that, that's, I can't, there's very few times doctors use the word cure in medicine today, and we can use that if you are that right candidate that fits into that.
Absolutely. And when do you think a patient should get a second opinion? I think it's important. It's not always easy to travel, or now with video visits, that's a little bit easier for a lot of patients. But how long should a patient wait before they get a second opinion on something like their seizures?
I think that you do not have to wait a very long time anymore. Typically, it's if two medications have been tried and you're still having seizures, I think it's time that one gets that additional look and see to make sure that is the diagnosis right? Do we know what kind of seizures we're talking about? Is the medication not the appropriate one given we have so many choices? I think it's as early as you've tried two medicines and for whatever reason, seizures continue to occur. That's a moment I would say, hey, let's kind of get an additional opinion, additional look at my case, just to make sure that we're on the right track and we fully understand what's happening, so that I can get this stopped as soon as I can and get back to my life, which is huge.
Absolutely. I think you said that so eloquently. Get back to my life. That's our goal for our patients.
Absolutely. I know one of the most important reasons that people kind of do things such as get a help and treatment is they want to be able to drive. I'm always amazed that that seems to be one of the biggest issues why people go down the road to, pun intended, to kind of get any type of epilepsy procedure. And the truth is we try to keep those quality of life measures at the front burner so that we understand what's important. And to me, that those are the best memories when things work out. And someone sends me a photo of them either in working or school or in the car, just to let me know, hey, you know what, this has worked out. There's nothing better.
I couldn't agree more. I was going to say some of my favorites are the pictures of someone holding their driver's license again. It's
Yes,
just so gratifying to see that we're able to get them back to it.
I completely agree.
Well, thank you, Dr. Servin, for taking the time to chat this morning. I also wanted to thank all of our audiences and, you know, everyone who's watching at home.
It's such a pleasure, and it's been such fun talking with you as well. And again, thanks to everyone watching out there. We hope we can help you with what you've heard today.